Hello, everyone, and welcome to the Mindful Momentum podcast. I am your host, Robin Todd, and I'm really happy that you're here today. So, I have a wonderful guest to interview. I have no doubt you are going to fall in love with him just like I have. I was very fortunate to meet Cal just maybe a few months ago through another, I think, person I interviewed on our podcast. And what started out to be a 15-minute conversation ended up being an hour. We had lots of common passions, and he just has is a wealth of knowledge. And I have no doubt you all are going to enjoy this. So let me introduce to you um, today's guest, which is Cal Byers. Hi, Cal.
Hi, Robin. Great to see you today.
Great to see you. So, Cal is the senior director. I'll tell you a little bit about him of SAFE workplaces for the national nonprofit SAFE Project, which stands for Stop the Addiction Fatality Epidemic. With over 35 years of experience in risk management, safety, and wellness, Cal has been a dedicated advocate for the construction and manufacturing industry since 1996. He's a founding member of the National Action Alliance for Suicide Prevention and has served on its executive committee since 2016. Cal helped launch the Construction Industry Alliance for Suicide Prevention and has been nationally recognized for his leadership, named a top 25 newsmaker by Engineer News Record. Woo woo! Recipient of the NHAB's inaugural Mental Health Advocate Award. Awesome. And a 2025 inductee into the National Academy of Construction for his distinguished service in mental health and suicide prevention. Awesome, Cal. Thank you so much for your service. Outside of his professional work, Cal has been married for 37 years, is the proud father of 5 adult children. He enjoys watching hockey and soccer, spending time outdoors, hiking and gardening, and getting lost in a good book. Are you reading a good book right now, Cal? Just quick question before we start.
I am rereading 2 books for a project that we're doing for Recovery Month.
Okay.
And one of them is called Recovery Allies. And it's great. And I just ordered a new book after I spoke with an author yesterday. And I'm really excited about that. So I
Nice.
have 5 books I'm currently reading. I'm a little bit behind the power curve, but
Yeah.
it's always something that I do enjoy.
Yeah. As we just said, it's too bad we can't take a sabbatical and just read because my stack of books just keeps getting higher and higher. So many good things to read in so little time. So, Cal, so that was your bio, but I would love for you to kind of share with our audience, how did you end up in this space? Because it's kind of interesting.
Well, I am grateful that my family was very supportive of mental health growing up. I'm the oldest of 5 children. I came from a broken home, and my mother, when she remarried a wonderful man who became the only father I knew, they sat me down before I had the birds and bees conversation and shared mental health challenges, including substance use challenges on both sides of the family tree. And you can always talk to us, and we have insurance. And if you ever need help, it's available. I
Wow.
went to school the next day, and it took me 6 years to find another person whose families had ever shared that. It was my freshman year of college when another or a student I met shared when I was a child. My parents said the same thing. So I recognized right off the bat what a gift that was.
Yes, such a
Um,
blessing. Because especially in, I feel like older generations
yes,
like ours, I mean, I feel like we talk about it more now than we did back then.
yeah, it was truly like a unicorn moment. It was so unusual. I just feel blessed. And we did have an uncle return from Vietnam, and he'd experienced a lot of stigma. He experienced substance use disorder. And so
Mm.
my family, I think, just recognized the kids have already seen things. Let's just be honest about it and let's talk about it. So that stuck with me. And within about 6 months of that conversation, we had a suicide in our neighborhood
Mm.
and in our family, extended family. And we saw that teaching people grief and bereavement was a really powerful healer. And it allowed people to lean in and accept help and offer help. And I'm really proud my parents really modeled that positive behavior.
Mm.
Even when it wasn't comfortable for them, they recognized, if not us, then who? And I clearly got that early upbringing
Yeah.
influenced
Well, and
the
how
way I
inspiring just even for our listeners who are parents today, because sometimes there's so many things that you want to teach your children, but what a beautiful, small, doesn't have to be a big deal, but just embedding that conversation and those allowing it for opportunities to talk about that and making it normal. What a gift it will be. So all those parents out there who are still parenting, and I'm a grandparent, so I get to do it now as a
I
grandparent.
remember.
Yes.
I
But
think it's
so
powerful because my
yeah,
wife and I decided that strategy when we were intentional about having children.
yeah,
We made a pact on how we were going to raise our children to have social consciousness and to treat people well. And we also agreed that we would be open about mental health and substance use, and really was powerful. And to see 5 children model that behavior has been wonderful.
yes. Beautiful. Okay, keep going on your story. Sorry, we got
Well,
sidetracked.
and that
And
doesn't mean that our family hasn't had struggles either.
yeah,
And it meant that we were equipped to deal with those challenges.
yeah.
So my story continued in my teenage years. I had 3 knee operations, and I have experience personally with prescription use, misuse, and abuse.
Mm,
I learned that coping skill from a family member who lived in chronic pain. And when my physical pain turned to emotional pain, I increased my use of pain medication. And I'm very fortunate when I did talk to a doctor about not renewing my prescriptions that I was going to apply for a job at a hospital and I needed to have a positive drug test. Was there going to be any problems? And he said, no, you have a prescription. Doc, what if I'm taking more pills than you prescribed? It's okay. It's expected. You have a serious injury. You've been rehabilitating it. Doc, what if I'm taking medication that you didn't prescribe for me, but it was available in my home? You're doing what? And we had a very candid conversation, and he was very disappointed. He expressed a lot of concern. He was graceful, and he said, now, we have to talk to your parents. And we did. And my parents, to my surprise, even though they told me they wouldn't judge, were there for me. And
mm,
the only thing I would say we do differently today is they said, don't ever talk about this. Like, this is in the past. You survived it, you dodged a bullet. Now forget about it. And generally, we didn't use words like recovery. And I was always concerned about sharing that story because I was embarrassed and I was shamed. And if you're being told to forget about it, it doesn't feel good because it was part of who I was. And what I learned, Robin, was never judge someone else. Because if it could
mm,
happen to me, it could
yeah,
happen to anyone. And so I'm
absolutely.
grateful I had that lesson. And I'm grateful that I didn't have to worry about not having a prescription to refill, not having to purchase substances on the street. Didn't have to worry about heroin, didn't have to worry about fentanyl today. And so that lesson of not judging um, really helped propel me to becoming a stigma buster in my workplaces and in my career.
Yeah. Well, that's our life of mindfulness. It's being without judgment.
A lot of intentionality and
Mm,
being purposeful and recognizing the power of words and the power of actions,
yes.
stepping up and being there for people when they need it.
Yeah. I love that. And then tell us a little bit more about where you went from there.
Yeah.
'Cause you didn't go into intentionally go into
No,
this mental health, well-being space.
I worked in an emergency room. I worked in an ICU. I worked in an organ transplant unit and served also on a burn unit and a neonatal intensive care. And I really was exposed to what you would call traumatic experiences.
Mm,
I recognized I shouldn't become a medical professional. I did go 6 weeks one summer without sleeping well.
mm,
And I had a charge nurse at the organ transplant unit who took me aside. She asked how I was doing. She clearly could tell I wasn't doing well, but I kept saying I'm fine.
mm,
And she stood up and gave me a hug. And it was probably a 4-minute hug. And she was the one crying. She said, "We didn't take good care of you. We didn't recognize this. We're so sorry. We're going to
Mm,
help you. You're going to be fine." And I'm standing there. Do I hug her back? That's awkward. Do I just acknowledge it? Like, it's okay. I'm fine. Really, I'll be okay. So, Robin,
mm,
she said, "We're going to give you the summer off. We're going to have you come back. Your job is safe. We want you to come back. If you choose not to come back, it's okay. The only condition we're going to ask is that you see someone." And even when I explained it to my parents, they're like, "That sounds like a good thing." I'm like, "Okay, sounds like I have to go see a shrink, right?" And the caregiver asked me about my childhood, and I described things and what I'd experienced and my healthcare experience. And I'm describing it as a normal experience, loving family, roof over my head, had enough to get by. My parents made sacrifices, sent me to a private school to give me better opportunities than they'd had. And all I saw her was crying. She's like, "It's anything but normal. Like, you poor thing, you've had all this trauma."
mm.
And I actually didn't feel that. I felt fortunate to have been able to care for so many families and to have worked in a caregiving environment, but I recognized it wasn't healthy. Um, so I decided that I would do something different. I have a master's in city administration. I worked for a county, I worked for a city. I consulted to about 400 cities and counties in 40 states over the first 8 years of my career. I loved public safety, and I learned about tough guys, tough gals, and mental health. And they trusted me. And I was able to open up and get them to share and to seek help. And it was a powerful thing. I did a suicide prevention project in the workplace, 1992 to 1994. Why do people attempt suicides in jails, and what can we do differently? And at the end of that project, I got invited to come to the construction industry. And people said, "We want you to teach people how to build caring cultures." So
And
powerful
that was
experience.
early.
It
That was
was
early.
early.
Yeah.
And I got to hire amazing professionals that I'm so proud of. We didn't know what we were doing in terms of this mental health space, but we started teaching people this idea of critical incident response to address emotional needs of employees after traumatic experiences. We
Mm,
reduced the time it took to report fatalities to the insurance company so we could provide more support and give grief and bereavement support, help the company prepare when something tragic had occurred. We got good at getting nurse case managers to help support employees and families when there was a catastrophic injury. So there were a lot of things that were happening. And then the insurance industry was doing a lot of drug testing. I was a crusader to help companies institute drug testing programs because the Construction Industry Institute called it a high five impact zero injury technique. And then I recognized that people who refused a drug test or failed a drug test didn't always get help. And I
mm,
really was conflicted by that because I'd had access to help and care. And so I toned down. I started seeking support from employee assistance programs. How do we help people access your service? What support can you offer? What if someone needs treatment? Tell me about these employee health benefit plans. I was more of a workers' compensation person.
mm.
So, Robin, it was very accidental and it just became this organic pursuit to help people.
Wow.
But candidly, it was post 9/11 and then definitely post Hurricane Katrina, doing that critical incident response. Hundreds of companies over the next 5 years sought my help and assistance. Families of those employers started calling me. "Hey, I've got troubles with a family member. You're good at helping people. Could you offer me guidance?" And I was blessed. I had an
Mm,
incredible mentor, gentleman named Bob Vandepaul, who was and is a behavioral health specialist. He taught me this idea of psychological first aid, how to take care of people.
mm,
But more importantly, he helped me build this army of helpers, of people who were willing to roll up their sleeves, share their support and guidance in a time of crisis. So whether I was in Minnesota or Pennsylvania, or ultimately when I moved to Washington State in 2014, I had this network of people that I could refer people to. And to see changed lives from that investment of other people made me just become this incredible ally. And
Oh, that's
when I moved to
amazing.
Washington State in 2014, it was to work for a third generation family owned business that allowed me to make mental health and suicide prevention part of our core risk and safety management strategy. And the owner of the company, I'm sure he didn't regret saying yes, but he said, if you're sure it's going to help one person, why wouldn't we do this?
Mm, I love that.
And
Yeah.
we packed up and moved to
Mm.
Washington State.
What a trailblazer you are.
Uh,
At a time
yes.
where, that was all just not even in lots of different conversations. I mean, I just feel like it's beautiful to hear even that back then you were working and I know others were working too, but it really is an example of how long it takes
Oh,
to shift this culture. And you got to be in it for the long haul, right? Because it's these small steps and we're getting closer, and every time I feel like we make progress, even with one organization starting to, do something, it's like, it's baby steps, but it's something. And what a beautiful example of the owner recognizing that the investment, while I'm sure was great, um, how do you put a monetary value on someone's life?
no.
So
And I'll tell you, like,
kudos to him.
kudos to him and that entire organization.
Yes.
We got further in the first 4 months of me being here than I had in the prior 8 years. And I take off my glasses and I do that V8 moment thing where you bang your forehead because that's all it took to get to the next turning point.
Mhm.
And that truly became a tipping point. There'd been prior turning points, but nothing that dramatic where associations started jumping in, labor unions definitely doubled and tripled down. There
Mhm.
was just so many helpers, people who wanted to provide help to others.
Yeah.
And it still warms my heart to see how this industry of problem solvers is tackling this one so openly, so
Right.
rawly, but it's
Well,
powerful.
I think once you start talking about it, in our experience, we have found, my colleague Nancy and I, um,
Yes.
we notice once you open the door, you start to realize that we all got stuff. We've all got things that we're navigating, challenges that there's really nobody immune, no matter how much money you make, where you're located, your age, your gender. We're all affected, and I think it is so freeing when someone is brave enough to start that conversation and just yeah, be honest and
Be
authentic.
honest.
Yeah,
Make themselves vulnerable.
yeah.
To say I need help takes courage.
Mm,
Today, there's many more people ready to offer help, and there's so much less finger pointing and questioning, and
yeah.
people are more ready than ever to offer help.
Well, and
I'm
that's
excited.
because of the work that you did many years ago. So thank you for
Well,
that.
there's a
And
lot of
others.
people
I know.
who definitely supported along the way. And I
Yeah.
always try to acknowledge as many of those early adopters.
Yeah.
One funny story was being appointed to the National Action Alliance for Suicide Prevention in 2010. And I was a representative of workplaces, but not a full time clinical or non clinical behavioral health specialist. And by 2012, I was starting a construction subcommittee, and it took me 6 months to get my first volunteer. And I'm like, oh my gosh, this is going to be an uphill climb. And I begged that person, if you do this, I promise I won't bug you again in your whole career. I will let you be.
Mm.
Her name is Trisha Kagerer, and we needed Trisha. She opened doors. She was willing to be a pioneer, and I'm always grateful for that support. I've never forgotten that
Yes.
because without her, it might have been another 6 months before I
Yeah.
found someone who'd say yes.
Yeah. Well, and I mean that leads me to just really be reminded of the importance of having champions. We're in various places, but if you can get people on board to champion this, we're just so much stronger collectively.
Yes. And I have to give kudos to the Construction Financial Management Association. They were the first organization. And people say, really? A group of financial managers? Yes. I'd been teaching human capital risk management since about 2004. And I recognized in the insurance industry, my skill set was best suited not for the insurance coverages, the technical things, or the financial risk transfer. Mine was the assessment of risk and what companies were doing to build these caring cultures. And human capital risk management took me down that path. And it's what led to doing emergency preparedness, disaster response, the crisis management, critical incident response that opened the door to these conversations. And
Mm-hmm.
CFMA in 2014 and 2015 said, yes, we will help you amplify this message. And they
Mm-hmm.
helped us start a group that exists today as a separate nonprofit called the Construction Industry Alliance for Suicide Prevention. That was October of 2016. And they were visionary. And the fact that they called it, you know, the URL at the time and today is www.preventconstructionsuicide.com. There's no candy coating that one. That was as direct as you could be. And it was succinct and it was
Clear.
powerful.
Yeah, absolutely. Yeah, awesome. Tell us a little bit about Safe Project that you're with now, or Safe.
Yeah.
Yeah, that's, I want to learn a little bit more about that, and I'm sure our
Yeah.
listeners do too.
It has existed since 2017. It is a national nonprofit. It was founded by a naval admiral and his wife who lost a child to an overdose and a co-occurring substance use disorder with mental uh, health concerns. And they felt if this could happen to our family, it could happen to any family. And very bravely said, let's build a system that will drive systemic change. And they decided we needed to build something that would be comprehensive and it would impact people in other sectors. So we have four major portfolios, we call them Safe Veterans, which provides support to veterans and veteran service organizations, including caregivers.
Mm.
We have Safe Campuses, which focuses heavily on college campuses with collegiate recovery programs and also K-12 schools. Safe Communities, which will be various organizations from treatment and recovery centers to recovery community organizations to you name it. There's so many. And then I'm the senior director for Safe Workplaces. I partnered with them for 3 prior years before joining their staff. And what's interesting is on that National Action Alliance for Suicide Prevention, I was lobbying and championing for the intersection of substance use, mental health, and suicide to be in the 2024 National Strategy for Suicide Prevention. And when I heard in the fall of 2023 that that was going to be one of the principles of that national strategy, I reached out to several nonprofits to say, this is where I want to spend the remaining years of my career. I feel like we can destigmatize, we can move substance use more to the forefront and reduce suicide and overdoses in that fashion. I found in Safe Project a willing partner. They were humble. They looked to avoid redundancy. They looked to amplify the efforts of others. They wanted to normalize the conversation of recovery, and they wanted to give people pathways to help, hope, healing, and then recovery. And I felt like this alignment with them
Mm.
and really proud to be part of that organization and to see the great things that are being done.
Yeah.
It's hard work, it's demanding work. You still see a lot of stigma with substance use. We see it on overdose as well. We've spent a lot of time on opioid risk reduction, and getting naloxone in workplaces and on job sites and seeing a lot of positive movement. And yet, I tell people it's easier to talk about the crisis of overdose than it is alcohol and tobacco. People are not comfortable dealing with legal substances that still are addictive in nature.
Mhm.
So we have a long way to go. And I felt this was the right place for me to harness my energy, passion, the connections I've made in public health throughout industries to try to bring solutions and help amplify efforts of others.
Yeah. And you kind of mentioned this, but I'm curious as to what resistance do you see? What resistance do you encounter? Are there certain typical things that seem to kind of bubble up over and over that hold organizations back from working with you or, kind of embracing this, um, developing this culture within their organization?
Yeah. And Robin, that's such an insightful question because people are open. We can have the conversation. No one is outright dismissive. There's a lot of wondering if our executive team is going to support this.
Hmm.
Alcohol is legal. We don't care what people do in their personal time as long as they show up. Yes. There's probably a lack of understanding of why people use substances and how alcohol and other substances can become a maladaptive coping mechanism. There's a lack of understanding of how to offer support and guidance, truly a lack of understanding of how big that barrier is. We think by offering them an EAP that that's going to help them. Most people don't take advantage of that benefit.
Right.
Most company leaders don't know if their health benefit program offers support for behavioral health. So, underlying mental health and a substance use challenge.
Yeah.
And I would tell you today, what I find is about 70% of organizations believe they're sharing information on addiction treatment and recovery, but about 80% is reactive versus proactive.
Ah, yes.
We wait for a crisis and then we respond, but we haven't prepared. We don't have resources locally. We give people referrals to the EAP or to the benefit navigation.
Yeah.
So we have a long way. We still have a long way to go.
Yeah, absolutely. I found in conversations, you talked a little bit earlier about that kind of that legality fear of like those boundaries, like, legally can I ask people or can I talk with people about the things they do on their in their personal life and things like that. And I think there's just misunderstanding in that space. And I'm not saying there aren't legal things that obviously HR is going to be involved in, which is important. Nobody wants to get into a bad place, but I think sometimes it's an easy out
It
to,
becomes a fallback.
yeah,
If you
exactly.
receive federal funding or you do federal projects, for example, some states as well, that drug free workplace policy becomes the default. And since 1988, that Drug Free Workplace Act, drug free workplace policies were required. If you have DOT safety sensitive work functions, could be anything from pipelines to aviation to commercial vehicles and others. That idea of safety sensitive requires drug testing. So I do hear often, we have a drug free workplace policies. Cal, I think we got it covered.
Mhm.
When's the last time that policy was updated? Do you reference the overdose crisis? Are you educating people about substances they or their families could be encountering? Have you talked to them about the poisoned drug supply, that no recreational drug use is safe? Have you offered them Narcan? And the open organizations will say, tell me more. The others will be like, well, I think we got it covered. Don't worry
Uh-huh.
about us.
We're good. We're
We're
good.
good.
We got that EAP check, kind of
Yep.
little check mark and kind of wash their hands of that. But, I also love you highlighting the the reactive of the crisis. I see that a lot where there is a crisis. So it's like, oh my gosh, those emotions are high. We got to work on this. We've got to invest in this, and then everybody kind of eventually kind of shifts back to that autopilot, of well, everything's calm, kind of gets back to a calm state. And it's like, but for how long, right? I'm like, I'm right there with you. We've got to be proactive, and that is just so not our culture in many aspects of being
Yes,
proactive. Just building in that foundation and that education, and continuing to keep those doors of communication open and educating, and all of that. And I think, this is what, of course, we promote at Mindful Momentum is when we do that, then we can reduce those crises, and we're not going to completely
yes.
get rid of it, but I know it's so opposite of what we do in our culture.
But it's what is so encouraging and what is so hopeful. The work that you and Nancy do, it's definitely upstream and it's definitely more preventive. It's a holistic health approach. And if we can improve people's mental fitness and their physical health and well being, we can reduce a lot of that tendency for that reactive crisis.
Yeah.
And Robin, I think when I teach people, it's HR, safety, operations, risk management professionals, I'm saying the four events that I see organizations not being prepared for are: a person refuses a drug test, a person fails a drug test, a person gets a motor vehicle infraction in a personal or a company vehicle and knows the organization is going to learn of it. So now they have to disclose. Or the fourth, they're not going to be at work because there's some family medical crisis. It could be
Mm.
medical, it could be behavioral health, it could be legal, a DUI, it could be a disturbance on a weekend, like a bar fight. And the person's like, I got a call because I'm not going to be at work. And the company then is, if they're not prepared, if they haven't vetted resources, if they don't know how to talk to that employee, it's a little late to offer an EAP because some of that would have required better pre-planning. They're
Yeah.
already in a healthcare system. So instead of getting to choose which facility they go to, they might now be at an out of network facility that's going to cost them more out of pocket. And the saddest ones are where I'll ask, do you have an employee assistance program? Do you know if you have behavioral health benefits? And I'll frequently hear papers rustling or shuffling in a desk drawer. People are looking, and then let's get that person help today. Here are some organizations that have support and resources. There's no one vetted list, but I encourage companies and I help them build those types of lists.
Yeah.
There's a lot of support. It's hard when you're under the gun of a crisis to
It's,
guide people at the right point. This week, for example, we're recording this on a Wednesday, but I've helped two people help two employees with the need for a recovery bed,
mm,
and neither was well prepared to help, and it took hours to make calls on their behalf because they were not prepared, not ready. And then I have two more examples of organizations and what we did to help. But boy, it works way better if people say up front, we have to be prepared for that inevitable, because it is truly not a matter of if, but when you will have that need.
yeah. Well, and my hope is that those people, now that they've experienced it, they see how important that is, that hopefully that'll be the catalyst to being better prepared for the next time, because we know there will be a next time. And yeah,
It
that's
would be disheartening if it didn't lead to good outcomes, right? If it
yeah,
stayed the status quo, but generally, you're right, Robin. What happens is those organizations, they take next steps.
yeah,
Cal, learn some things here.
Yeah.
You've identified some community organizations. We're going to do a lunch and learn. We're going to go kick their tires. We're going to go walk a treatment center. We're going to understand what detox means.
Yeah.
So there is something positive about that.
Yeah.
Sadly, as humans, we do learn best when there is a crisis or some type of pressure.
From that experience, right? Instead of you telling them they need this, but until it happens, yeah, sometimes it's they need that to kind of get in gear. And I think too, we just live in a world where everyone's so busy.
Yes.
This is the gift of mindfulness is that when we can really slow down and be present and be without and then be intentional about the people around us, because I truly believe that we are all designed to care deeply for each other. We just get so swept up and so overwhelmed with all the things that everyone is just so busy doing, whether it's work or family or whatever, that we just are unable to see that and really be the kind of human being that we all want each other to be, which is to be seen and heard and valued and appreciated and cared for, when we are, struggling. So, yeah, I get
And
it. It's just, which is why, I'm passionate about sharing the message of mindfulness because it really is at the root of all of this change
yes, the
that,
way you describe it, who wouldn't want that description? Likewise, recovery, being able to live a life to your fullest potential in a self determined way, promoting your health and wellness. Who wouldn't want that? We all have that 168 hours a week. And it comes down to time allocation. It comes down to pressure. It comes down to being overscheduled. There's so many
yeah,
barriers to being mindful. It
yeah,
takes discipline. It takes intentionality. I use that word a lot. So when
abs,
you say it,
yes,
it's therapeutic for me to get
yeah.
that reminder.
Well, we're a work in progress. You and I, just like everybody else that's listening, we have to, and I have to keep at it all the time. But I'm grateful that I have opportunities to talk to people like you to help us kind of support each other in that effort. So tell us a little bit about moving forward. What are your aspirations? What would you love to see happening in workplaces, the construction industry? Like, what is kind of your goals and your aims maybe before you retire or in the, next 10, 15, 20 years?
I'm hoping that there really will be this army of helpers to fill the gap. And I'm confident that there will be. I used to think I wouldn't be able to retire, that there was still too much work to be done.
Mm.
And today I'm really optimistic because I see how many people are adopting a positive, mentally healthy culture and that people are embracing this idea of recovery. We still have a long way to go, but I'm hopeful. So for me, there's a few things. Next February in Portland, Oregon, the fifth annual Construction Mental Health and Wellbeing Conference is occurring. I am hopeful that I will stay active through the 10th annual. So that's kind of one of the goals I've been setting.
Nice.
I want people to think about that. I'll be sharing information with you and Nancy so you're able to help promote that to individuals as well. Number two, one thing that does concern me, still less than 25% of organizations with naloxone in workplaces and on job sites. And it's not enabling um, drug use if you have naloxone. It's being prepared for an opioid emergency. People need to learn more about leading gateways for opioid use. And there's many ways people can overdose. So it's not going to condone or promote active drug use on your job sites. People have likely taken prescription pain medication or using it through the day to mask the pain, to play through the pain, to be a productive member of your team. Let's be prepared if there's an emergency. So the idea of leading gateways would be on and off the job injuries, medical, dental, and surgical procedures, and teaching people about leftover pain medication. We have
Mm.
drug take back programs, and there are methods to do at home drug deactivation and disposal. that has very low utilization. And we can do so much better, and we can protect people with naloxone, teaching people about the drug take back and deactivation programs. And a
Yeah.
third really important goal that I have, this idea of recovery friendly workplaces. In national surveys, less than 20% of people know what that means. So there has been some confusion based on different descriptions, but all basically mean the same thing, whether you call it recovery friendly workplace, a recovery ready workplace, or workplace supported recovery. It's having leadership support to meet people where they're at, to break down stigma, offer support and care, and break down barriers that keep people from seeking help. Yes, there are some policies and procedural changes and protocol changes. What I think is people are looking for an easy button, and they're looking for a one size fits all. Everyone's recovery journey is going to be different. And so we have to have flexibility, and we have to tinker and experiment and recognize there's not one path to recovery. So let's encourage people to come forward, and let's accommodate those requests as they come up. And there's something powerful about that. This works. And you build a loyal workforce that's looking out for other people, that offer peer support and guidance. So why wouldn't we want to embrace this? But I think it's been confusing. So for Recovery Month at Safe Project, we're going to be promoting different examples of recovery stories. We're going to be sharing some books and tools and resources, and we're going to have people reimagine what a recovery friendly workplace would look like.
I
And
love that.
those are three things that jump out. And
Yeah.
of course, there are
Agree.
more.
Of
But I
course.
think if I threw one more in, it would be normalize the conversation on de emphasizing alcohol at company sponsored events.
Mhm.
And that's a powerful part of being a recovery friendly workplace. But it would give people an opportunity to ask for guidance, ask for support.
Yeah. I
So
love
that's,
I love that you bring up about the recovery ready workplaces because this is a space that is kind of new to me. I'm embarrassed to say a little bit, but I mean, there's a lot of things I don't know. And I will completely admit that. But I've recently, I was actually doing a training with our peer support, and someone asked for, some guidance on how to kind of build relationships with people on the job sites. And so I started doing my own research, and it was so fascinating how, if we aren't aware, some of the behaviors that might be interpreted are completely wrong, right? Because
yes,
someone maybe is a little standoffish, or they're not going to happy hour after work, or they like a skip. I mean, different things that are part of their own personal recovery journey in terms of staying recovered that
yes,
others might interpret as, they're not engaged, or they're not, they don't want to join in, not a team player, those kinds of things. And I so appreciated that person kind of initiating that conversation, which led to more of my awareness and something that I am continuing to want to continue to talk about with people that I work with, and continue to do my own education on. I mean, it's complex. I don't mean to simplify it, but it's very
no.
interesting.
But I think we do have to deconstruct it and do it in simpler blocks. Because I think in its whole, it was confusing. It felt too big. And then my biggest concern was, as some organizations were rushing out to do certification, for example, either at a state or a national level, did they really have the framework in place? Did they have the benefit program, the flexible leaves policies that might be required? Do they truly understand that intersection of the ADA and FMLA and short and long term disability leaves? And again, because what happens is when a person asks for accommodation, then we're not ready. And then that person senses resistance instead of, yes, actually, we can accommodate that. If we have to, I got to get back to you. I got to run that up the flagpole. I got to go talk to HR. If managers were trained to know, yes, we're going to be making some concessions. And the challenge, of course, these could become precedents. And so HR and legal counsel are going to be conservative because they don't want to overcommit because we don't know if it's going to work all the time. There will be some persons in their recovery journey that return to active use. Sometimes that's called relapse. And many people will recognize that as part of recovery. It's part of the addiction healing and treatment recovery process. So it's not clean, it's not finite. There's unpredictability, there's a little bit of uncertainty, and we do better making decisions when we are more certain. So I get it. It's
Yeah.
complicated, it's hard,
Yeah.
but this is where I'm confident construction, suicide prevention was hard. We figured it out. Now we need to do the same with substance use and go
Yeah.
beyond drug free workplace policies, go beyond drug testing,
Yeah.
really offer pathways to help
Yeah.
for
And
employees.
at the root of that, it's compassion,
Yes,
isn't it?
yes. It could start with concern
Yes.
and care
Yes.
and then compassion, right? There could be a continuum there.
Yeah. Thank
And
you.
I agree with you, though.
Yeah.
And I think all of what you and Nancy do with mindfulness, with meditation, those are practices many people in recovery already embrace.
Oh, yes.
So if that works for people in recovery, it's probably going to work really well as a prevention strategy. We just have to normalize it in the workplace. So
Absolutely.
that's why I was so
Yeah.
encouraged when I met you and had a chance to talk to both you and Nancy.
Mm.
I
Well,
You're part of that solution.
yeah,
And the more tools we have in the toolbox, the more people we're going to reach.
absolutely. That's what
So
it's
I
all
just wanted
about.
to encourage you as well.
Mm, thank you.
And what I appreciate about you is your calm demeanor. That is therapeutic. It's very
Oh,
healthy.
well,
And
thank
so I'm grateful for that partnership that we've built and looking for pathways to collaborate with you going forward.
Yeah. Well, thank you, Cal. I appreciate that.
Thank you.
Um, yeah. Well, I would love for us to kind of pivot a little bit and as we kind of wrap things up, what would be one thing that, and I know we've talked a lot of different things in our time together, but what advice would you give an organization or an individual, let's just say in the construction industry, struggling, whether it's mental health for themselves, a family member, or they're inspired by the things that you've said in our interview and they want to do something in their organizations? What would be one small step? I feel like, sometimes we can get too big and we have these, we want to be there yesterday, but it takes these very small steps to start moving the needle and start, creating these cultures, whether it's, helping ourselves, our families, our communities, or our workplaces. So, what advice would you give someone who's interested and ready to take action?
For leaders, I talk about 3 V's of leadership. It's being visible, vocal, and vulnerable supporters.
Mm.
So, your 3 V's, if you embrace this, it sends a message to others in your organization that it's safe to talk about this, it's safe to seek help. That vulnerability is so key. So if you can't be vulnerable yourself, is there another member of your senior leadership team who can be vulnerable? You can still be visible and vocal if you can't be vulnerable, but please find someone in the organization who can be vulnerable. So that's for leaders.
Awesome.
For
Yes.
managers and supervisors, it's be the one person who's going to make that commitment to ask, are you okay? And to take time to listen to the response and to challenge back politely in private, are you sure you're okay? You've told me you're okay, but it doesn't seem like you're okay. I care about you. I'm here for you. If you
Mm.
need to talk, please call me day or night. And if you're the person who is struggling, please trust 988. It's private, It's confidential. It's available 24/7. And there are trained volunteers ready to take your call and to offer you guidance and support. This is a powerful tool that is helping millions of people.
Yes.
So, those are three things that
Yes.
relate to help offering, seeking, and supporting.
That's
And
it. Yeah. I
that's
love
the
that.
one thing I'd want people to know.
Yeah. No, I love that. I love that visible, vulnerable, and vocal for our leaders because if we can be top down, we're gonna we're gonna shift things much
Yes,
quicker.
that's culture and leadership.
Yes, it is. And
And
it's
those three
so
V's,
important.
I'd been speaking of them, but did a national survey with the Center for Workplace Mental Health in 2021. I was one of the co authors, and it became clear that the organizations where leaders were willing to be vulnerable, there was like a secret sauce. That vulnerability opened Pandora's box, and people were willing to talk with openness. They
Mhm.
trusted. There was that idea of psychological safety. They knew that they weren't going to be judged, they weren't going to be kicked to the curb, that there was going to be care available for them.
Awesome. Wow. Um, and then you said the managers. Oh, and then 988. Oh, that was one thing I wanted to say. So this is kind of cool. And I don't know if I've mentioned this on our podcast before, but with one of our trainings, we actually called 988 as a group and we put them on speaker. And honestly, I was a little nervous. I've never called 988. But what's so beautiful is it's not only just for you. It's
Yes,
for if I'm worried about my child or I have somebody, my neighbor that I'm not sure how to support. I mean, it's so much more of a resource than just if you're struggling. And I guess, I think there's misconceptions about that. And so
yes,
I just want to encourage people listening to use it as a resource for just information. They will look at your location.
yes.
I think originally maybe it used to be where you were call, well, it was something it was they kind of have
The
fine-tuned it.
exchange of your cell phone, your area code,
Yes, but anyway, so it's applicable right where you are, if
it is.
not just for you, but the people around you, people that you see in need. And I just thought, wow, if
They'll take
everybody knew this, it could be a even more utilized resource.
I love that you did that in a training class because, again, it's normalizing, it's showing people. And if
Yes,
you've gone through a demonstration call, you're going to be better able to explain it to someone. And you'll
absolutely.
know press one for Veterans Crisis Line, two for Spanish speaking resources.
And we got the most lovely, gal. And she was just, I said, I have you on speaker. We're doing a training and we're just calling to see what this is like. So it kind of takes away some of that fear. And it was good for me too, because as I said, I was just a little scared. But yeah, I think it normalized it for all of us and hopefully will nudge us to use it, in a variety of situations. So
And 988 is so much easier to remember than the prior 10-digit number. So for people in crisis, it really is easier. We all remember 411 and we remember 811. We remember 911, but
yeah,
we're remembering 988 and
it
it's
is.
powerful. I'm really excited the
It,
progress that's been made.
yeah. So, Cal, as we wrap up, I would love for you to share with our listeners because I always wrap up really just being authentic in my own personal work of living what I'm asking people to do, and I know you do too. So, what's your go-to right now that you have found helpful for you to manage stress, life, whatever it is you're experiencing?
I've had a really great revelation this past 15 to 18 months. I've been very intentional about sleep. And I noticed that when I was dehydrated, I didn't sleep as well. So, hydration throughout the day.
Mm.
Number two, about 340 days ago, I went alcohol free. I felt like that was disturbing my sleep, even if it was just one or two beverages, not every night, but multiple times each week. And the third, and it's been really profound, I averaged 78 sleep score, not using an essential oil, but about 40 days ago, I started using an essential oil dabbed behind the mastoid, behind the earlobes, and it's called parasympathetic. And it is clove and lime oil. And it was designed to reset my parasympathetic nerve response. And my sleep score in that 40 days is averaging 84. So the only change I made was that. And even on nights when I'm not getting my targeted 6 hours and 30 minutes of sleep, which I know is still less than what's indicated, um, if I get 5 hours and 15 minutes because I'm traveling, I'm still getting 84, 85, and I'm impressed. I was skeptical, but I'm becoming a believer. And
Yeah.
when you asked me, it was be those three, the
Okay.
combination
Love
of
it.
alcohol free, proper
Yeah.
hydration, and
Yeah.
then this essential oil.
Well, and I feel like, any kind of research you do on sleep, alcohol, it's always comes up as that disrupts
Yes.
your sleep cycle. Hydration is important for everything.
Yes.
But I love that you've added the essential oil, and I'm a big essential oil fan. I don't use that one, but I'm going to have to look that one up, clove and lime. I probably have both of them because I have a bit of a quite a collection of all kinds of oils and recipes and things like that. But I love that, and I just appreciate that you were courageous enough to try something a little outside of the box. I think sometimes, people think that stuff is woo woo, and then they don't venture out to something that, can really be beneficial. And sleep is so important for our health, well-being.
I have to give a shout out to Sonia Bowman. She's the executive director for the Construction Industry Alliance for Suicide Prevention, and Christy Domboski, a favorite editor at the Construction Financial Management Association. She's now a VP of marketing and branding, but those two talked about it and talked so clearly about the health benefits. I called Sonia when I was in a period where I was struggling with sleep, and I'm like, all right, Sonia, I need your help. We're friends. And she was so gracious and so willing to just break things down. I went and explored, found a company here. I live in Washington State for now, and I got a test bottle of $15. I bought three for $38, and I'm like, I'm hooked. It's
Nice.
been very positive, and
Yeah.
just the smell alone, Robin, settles my nerves and makes me calm, ready to zonk out when my head
I,
hits the
well, I was
pillow.
going to say, have you tried it during the day or do you just do it at night?
Just at night. That was its indicated use. I
Okay.
wondered what it would be like during the day.
Yeah, if you felt a little anxious, before like something, I don't know, as long as it didn't, knock you out, which it's not
What
going
I
to.
what I felt was I needed that reset of the parasympathetic. I felt hyper vigilant. I was helping so many people and so many calls, so many demands on my time that I was having a hard time just catching my breath and preparing for sleep. And now I found, 10 minutes before sleep, it is part of my
Your
sleep
routine.
hygiene, my
Yes.
routine
Yes.
to
I
prepare
love
for a good night's sleep.
that's great. Well,
So yes, I loved how you said woo woo. One of my friends said that sounds kind of foo foo, and I'm like, don't
foo-foo.
go there.
Hey, you know what? If it works, you just you're grateful, whatever it is.
Grateful.
Whatever
Yes.
it is. Yes, awesome. Well, Cal, it has been such a joy visiting with you. If some of our listeners or viewers want to reach you, how could they get a hold of you?
Yeah, the best way is Cal, at safeproject.us. And then I do give my cell phone number. Don't call me for a crisis. If you need support, convincing leadership about mental health, workplace suicide prevention, overdose prevention, I'll welcome any of those calls. Please call 988 if it is a behavioral health crisis. My cell phone number is 651 307 7883. And welcome your call. If I don't know you, you can text me, you can email me. I'll be happy to connect you to anyone in my network that can help you help others. So
Awesome.
thank you for that, Robin. And thank
Yeah.
you very much for this conversation. Thanks for your spirit and all the work that you and Nancy are doing to
Well, and
promote mental health, mindfulness, and well being.
Well, likewise, Cal, it's been a joy. And as I always end with, we are here. The Mindful Momentum podcast is here to inspire and empower all of our journey toward living a life of mindfulness. And you can always like, comment, subscribe, share this podcast. Reach out to me at Robin at mindful-momentum.com. We're here to support you as well. But thanks again, Cal, and thank you for being here. And we'll see you next time.